G'day and welcome back to the channel. So in today's video, I want to show you how you can fix ITB syndrome. And the way that I want to structure this video is I want to talk about a common misconception around ITB stretches and then quickly parlay that into some information about what I think is the best way to mobilize an ITB and decrease those ITB symptoms. But more importantly, as we get to the second half of the video, I want to have a conversation with you guys about why the ITB becomes a problem in the first place. So if you're someone who's been dealing with ITB syndrome for a long time now, or it comes and goes periodically, it's really important that you can grasp this concept and work on the things that I'll get you to do at the end of the video to make sure that you can solve this long term. And we're going to touch on this basically by going through 3 really important exercises that will address the cause of that issue that then goes on to potentially set that ITB up to fail. So please hang around if you're really interested in that sort of stuff. So with that in mind, the first thing I want to touch on basically is this common misconception about ITB stretches. And that is basically that you can stretch the ITB. Now, what a lot of people don't seem to realize about the ITB is that it's different tissue to muscle tissue. The ITB is a really robust connective tissue that obviously sits on the outside of the leg. It serves as a muscle attachment for your quads, your hamstrings, and your glutes and your hip muscles. But we can't stretch that in the same way that we can stretch tight hamstrings or tight glutes. But what we can do and what we should be doing instead, and this leads me into the exercise that I find really powerful, is we can or we should be attempting to feed some slack into that ITB. So by going after restrictions in your quads, your hamstrings, and your hip muscles, we can take out some of the excessive tension in the area that's causing that ITB to be overloaded and irritated. So a great way to do that is if you have a foam roller or a tennis ball or lacrosse ball, depending on what you feel comfortable using. I'll use a foam roller in this instance, but make sure that you choose something that's very respectful to the area, because if you've had ITB syndrome or if you're going through it at the moment, you'll know that that area can be obviously very tender and uncomfortable to push on. So choose something or a surface that respects how hard you want to go into that. So what I want you to do with this basically is, as I said, we can feed some slack into that ITB by releasing some restrictions in your quads, your hamstrings, and your hips. Now, I'll show you how to do this for the quads. It's the same technique for your hamstrings and glutes, just with a subtle difference going along, but I'll go through that quickly. So what we want to do first is we're going to choose the quads to begin with. Visually, it's the easiest one to see on camera, but it also tends to be the area that's the most tender, the most uncomfortable for people to get a massage or to get pushed into. But we want to show you how to release that relatively quickly. So the other thing that I wanted to touch on with foam roller exercises, and it's the same thing with the ball in a sense, is that for some reason there's a tendency for everyone to roll around. So once you're on that ITB and you just gently lean over a little bit until you hit that quad, it won't be too hard for you to find it. It might be very tender for you, but just go to a position that you feel very comfortable in, that you can breathe in, that you can talk in. Don't really dig in there so that you're about to pass out and vomit. It's counterproductive. Just find a position that you feel very comfortable with that hits a spot that you need to work on. Then instead of rolling around, what we want to get you to do is find a spot that feels a bit tender and restricted. Then we want to use movement to shear that tissue free. So to get my leg out the way here, I'm putting some pressure through that quad / ITB section, and then I'm using movement to shear that tissue past the roller. So again, only be as hard or as soft as you feel you need to, but do enough of that so you feel like that starts to shear free some of that tissue. So we can do the same thing with your hamstrings, obviously, but instead of bending your knee, we can straighten your leg to open up those hamstrings and get that tissue to release quickly. We do the same thing with your gluteal muscles up the top here. Because of the shape and the boniness of your hips, it is probably better to use a tennis ball or a lacrosse ball up higher. But all you want to do with this is you want to dig the ball in there, move the ball around until you find that you hit something that feels a little bit tender. And then you've got 2 options here. I'll get you to rotate that whole leg inwards and outwards, or you can bend and straighten that leg. But the goal is the same. We're trying to take the tissue that's restricted, we're trying to shear that tissue free, feed some slack into that ITB to take out some of the need for that tissue to be irritated and overloaded. So in my experiences as a physio, rolling isn't anywhere near as effective as the flossing or the putting some pressure on it and shearing that tissue past the ball. You should feel some immediate benefits from doing that technique as opposed to rolling. And then again, out of all the ITB stretches that you'll see on the internet, anything that treats it like a physical muscular stretch is very unlikely to make any significant gains quickly. So if it's biased more towards your quads or your hamstrings or your glutes, it might help vicariously, but it's not necessarily doing what it's advertised to be doing, which is stretching that ITB. So if you take a ball or a roller, go hunting around those areas for anything that feels a bit tender and restricted, it's a very specific way to find what's sort of glued down, what's holding you back, where those handbrakes might be, getting rid of them and feeding some slack back into that irritated area, giving it some time to breathe, allowing it to settle. So now the important thing we need to talk about here, following on from that exercise, is we need to have a conversation around why that area has become a problem in the first place. Because again, as we talk about on the channel a lot, it's not enough just to give you symptomatic treatments anymore. We need to have a conversation around why those symptoms are there in the first place so that you can work on fixing that as well. Otherwise, it's unrealistic to expect this to magically go away forever. It may, depending on what's going on in your life, but we can guarantee, as much as you can guarantee anything, that it's going to settle quickly if we improve the conditions that ITB is working in. So what I want to touch on next is we're going to go through three main parts of this conversation that I find clinically get missed a lot when trying to solve ITB syndromes. But I want to put it into context so you can understand why it's there in the first place. So the best way to show you this, I think, is via a squat. So when we're looking at just your basic everyday squat, it tells us a lot about how your legs are functioning. If you get ITB syndrome when running is essentially a mini squat to a mini squat, depending on your technique. But looking at you in a very controlled squat shape, we can tend to see all the things we need to know about what might be causing that ITB issue. And the one thing that I think is really important to look out for most people is we want to have a really close look and pay really close attention to what your knee is doing relative to your foot. And what I find clinically is the majority of ITB syndrome patients have a knee that wants to drop inside of that foot. So that can either mean that they're a little bit duck foot, and when they're running, when they're moving, their knees might feel like they're going straight, but relative to where their feet are pointing, the knees are still dumping inwards, creating a bad environment for that ITB. The second one is you might have your feet straight, but your knee might just dump in anyway. The reason why this is important is because your tissue is designed to function essentially like a piston, where things are going straight up and down, everything's loaded comfortably. As soon as we add in that rotational movement through the hip, through the ankle, it starts to increase the load through that area, potentially setting up for problems down the track. So if we're trying to release a lot of the tightness and the tenderness and the soreness in this area, we need to make sure we're then also trying to put the knee into a better position or give the knee a chance to be in a better position more often to stop that from coming back. So as I mentioned quickly before, there's three things that I think tend to lead us towards this position. There's two involved with the hip and one involved at the ankle. Now, we'll start at the ankle because it's the most obvious, is that if your ankle is restricted in any way, as your ankle bends, if you run out of range of motion at your ankle, the only way that you can go further is if you either turn your foot out or your knee caves inwards. Essentially what's happening when that does occur is that when you run into the end of your ankle range, your knee has to dump inwards to go around that restriction if you need more range than you currently have. And this is obviously a problem because if you're running and consistently in this position all the time, it's a constant overload for that ITB. So we need an exercise to help free that up quickly. And again, if you subscribe to the channel, if you're a fan of the channel, you'll know how beneficial the banded ankle stretch is for ankle restrictions. And again, I really like to have this band above the ankle. I just find that when you're in this dorsiflex position, it biases that capsule far better than being below the ankle, which is what you probably see most often. I wouldn't call this a personal preference. I just find that this works better for me and my patients. So all we want to get you to do with this is to stretch your foot out as far as you feel comfortable, lead with your other leg. All the exercise is basically bending that back ankle as far as you feel comfortable. Now it's easy to make sure that your hip translates past your foot before you bend there. Otherwise you'll end up being in a squat and that can be really tricky on your quads and your ITB as well, obviously. But again, like we mentioned briefly before, because we're trying to stretch you at the end of your ankle range, we want to make sure that that knee isn't caving in and compromising or feeding back into the thing we're trying to change. So when you're in this position, so obviously the band's behind here, make sure that when you bend that back ankle, that knee isn't wanting to cave in. Make sure that knee stays out. Even if you're not going as far as that, just make sure that you're at the end range of what you feel comfortable in a good position. And then staying there for 30 seconds, a minute, 2 minutes, is a really, really great way to take away some of the restriction away from that ankle. But then it allows you, when you squat again, it allows you a better path and a more stable shape that's not allowing that knee to dump inwards. So by taking away some restrictions at the ankle, it allows the knee to stay in a better position for longer, and it takes away one of the handbrakes that can force it to dump inwards, change the way you load the entire knee, including that ITB. Excuse me. Now, the other two things that we want to talk about here is, once we've mobilized that ankle, we want to talk about what's happening at the hip, because there's two things that can be happening here that tend to be a roadblock for a lot of people. So when you are doing a squat, if you don't have the muscular strength or the muscle control at the hip to hold that knee out into a good position, then the knee's going to dump inwards a lot more. The natural inclination, when there's not as much support at the hip, is for that whole leg to collapse inwards. So we want to go through something that helps improve the activation and the strength of those glute muscles in this position. And interestingly enough, squats are the best way to do that. So what I want you to practice here is I want you to practice keeping your feet straight, screwing your knees out. And what you'll find by doing this is you'll see that your arches will lift up a little bit. You want to maintain that position, squat down as deep as you feel comfortable before you feel like you run into the end of that ankle range or that hip range where you feel like the knee starts to want to cave in. So when you're doing this, feet straight, knees out, maintain that position as low as you feel you can go, come back up again, and keep repeating that process, making sure those glutes are firing the entire time. Now, if this becomes a little bit too easy for you, and obviously what we can do is we can get the booty bands, and I'll leave a link in the description if you want to pick some of these up. Put these bands above your knees. We can repeat the same thing. So feet straight, knees out, squatting down as deep as you feel comfortable, making sure that that knee doesn't want to cave in. Keep those knees out as far as possible. Now these bands are great because they force you to engage a lot of those hip muscles that we need to keep the knee in a good position. If you don't, the band will pull your knees together, essentially emphasizing that bad shape. So the booty bands are a great way to access and retrain those hip muscles in a short amount of time. Excuse me. Now, the third part of this equation, essentially, when we're talking about the hip, is that you also need to have enough hip range of motion or rotational range of motion to get into that position. So if you're doing a squat and we know that we want you to be out here, for example, if you can't actually get out there, then your knee is definitely going to end up in this position because you don't have the ability to express that further. So a great way to improve that hip external rotation, specifically at the hip, is with what's called the pigeon stretch. Now, I'd recommend most people do this on a chair or a table because it does require less range of motion to get into this position. But I'll show you on the floor here. The pigeon stretch is a great way to improve that external rotation at the hip, allow that knee to be translating out further, unloading that ITB going forward. So the position itself basically is an externally rotated position. So we want to get you to drop that front knee down, drop those hips down as far as you feel comfortable. Now we want to get you to hold this for 10 seconds, 15 seconds, 20 seconds, whatever you feel comfortable with. Give that muscle a squeeze. So tense your glutes, push your feet or your foot and your shin back into the ground. Hold that for a few seconds, then relax. You should find you can drop down a little bit deeper straight away. Same thing again, push that leg down, push your shin into the ground, tense up that muscle, relax, and then drop down further. And then what you'll find is as you're doing this, you'll hopefully see this on me straight away, is when you squat down, you should feel like now you have extra range of motion to work in. So by doing that, basically, excuse me, you'll be able to give yourself more permission to stay in a better shape for longer, unloading that ITB. And as I said, that position on the floor does require a lot of hip mobility to get there, but if you do it up on something while you're standing, it makes it a lot easier. So those three exercises are really important exercises that I find clinically that that my patients need to do to change the way that they're loading that ITB up. So it's not enough just to treat your symptoms anymore. If you want a realistic change in this long term, particularly if it's stopping you from doing what you want to do athletically, you've got to have a broader conversation about what else is going on around that. So I really hope that was helpful. Please let me know in the comments down below how it goes for you. But with that being said, we'll see you in the next one.